smiling.
First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Hi, I'm Dr. Kenny Levine with Health Talk. I'm here with Dr. Cory Lessner. I wanted to we were talking about medical things before. How about diabetics? Controlled or uncontrolled? Is that a problem?
Two things with diabetics. If the diabetes is in control, because when it's not, sometimes the prescription can fluctuate, we don't want to try to hit a moving target. As an elective procedure, we want to make sure that anything non-elective is taken care of first. So if diabetes is in control, and if the retinopathy or if the disease hasn't caused damage to the retina, the nervous tissue of the eye, that the person thinks that my surgery will fix that, that they understand that we're just replacing the glasses or contacts with the correction on the surface of the eye, then they're candidates for the procedures.
Okay, so if somebody's well controlled, whatever their illness is, they're fine. How young can somebody have this procedure done?
We usually like to wait for somebody to be able to sign their own consent form. I have treated people in their 17, going on 18, at age of consent, who are active athletes, people that are having difficulty with contact lenses, people with large amounts of astigmatism. Astigmatism responds very well to LASIK, and one of the misconceptions that still exists is that you're not a good candidate. And in many cases, I'd rather treat people with astigmatism. You've got no place to go but down.
You mentioned athletes, and I know that you're the doctor to the stars. Are you at liberty to say who you've taken care of?
Well, we've been fortunate enough to have been trusted by all 4 of the major sports teams in South Florida, which we've been working with for more than a decade. So some more known names for the Heat, Dwayne Wade, Mario Chalmers. For the Dolphins, people like Ronnie Brown, Ted Ginn, Channing Crowder.
Right.
For the Panthers, Christopher Stieg, Roberto Luongo, who was traded some years back.
How about for the Marlins?
And the Marlins, A.J. Burnett, Josh Johnson, the manager, Mike Redmond.
Okay. Early in my career, I was in an office with the team dentist for the Miami Dolphins back in the 70s, and these big guys are really afraid to go to the dentist.
Yeah.
How do they react to having their eyes working?
I think most of them are okay, because most of them have talked with other people that I've worked with and talked with the trainers, and I think it's getting to the point, at least in their case, we look at it as an enhancement performing procedure as opposed to a drug, which obviously would not be legal, but this is a way that they can improve their game, and most will tell you that it definitely does improve their game.
Let's talk a little bit about the procedure. You see somebody for pre-op evaluation, then what happens when they come to you?
Well, amazingly, the treatment itself, after people are tested and rechecked, we verify numbers over and over again. After I meet with the patient prior to the procedure, it's a 10-minute process. You're in the room for 10 minutes. The eye is numb with topical anesthesia. There are no needles of any kind. In the first part of the procedure, which takes roughly 3.5 minutes, a pressure is applied to the eye, a mild pressure, which causes the vision to black out for about 30 seconds. And in the last 6 seconds of that time, once everything's in position, we create this access point with these million bubbles with the femtosecond laser. The process is repeated on the other eye, and that is the only discomfort, if you will, that people feel. In many cases, when the people aren't squeezing, we hold the eye open with a little eyelid holder. And the people that are squeezing, they feel pressure. The people that keep their eye open, they feel little or no pressure. The table then swings to the other side, and the laser, now this newer laser treats each unit, each diopter of myopia in 2.5 seconds. So a person with a really significant prescription, -6 is a 15-second procedure, and there are some people it takes 1 or 2 seconds. The far-sighted people, people that have trouble reading and then later on distance, It's about 4 seconds a diopter. It's a slightly different treatment pattern. But in those cases, again, just a few seconds, person can sit up and see their watch. They can read immediately after the procedure.
Okay, we're going to get back in just a moment because a few more questions I have. It's Dr. Kenny Levine with Health Talk. Be back with Dr. Lessner in just a moment. Thank you.